Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare. Hey, everybody. Welcome back to Boombostic Health. I'm your host, Bradley Bostic. This is episode 40, and we have a really accomplished guest here with us today, Nigel, who is running a very cool company that's bringing AI to the administration side of healthcare called Diagnostic Robotics, which is also a super cool name. And I envision all kinds of really amazing things when I think diagnostic robotics. I look forward to unpacking that with you. But Nigel has this incredible background where he has gone from the napkin to the multi-billion-dollar healthcare startup and had a huge positive impact on healthcare through innovation, and has now gotten to the point where he is a CEO of this exciting new company that he'll share with us today. So Nigel, thanks so much for being here.
Great. Thanks for having me. Pleased to be on the podcast, and hopefully we'll have a great conversation.
So I'm in our Indianapolis headquarters today, and in front of our very favorite piece of art that my friend Eric Wallenstein painted for us with the Megatron looking guys that are shooting binary code out of their fingers. So like super ultra nerdy. I'd love to know where you're dialing in from today.
I'm in New York today.
And you make New York and Miami your two primary spots?
Yes, Miami and New York. We have homes in each, and that's split my time between the two places.
That's awesome. And you, based on your accent, you didn't grow up in New York. Like where are you from?
Yeah, sure. So I grew up in the UK, as you can probably tell from my accent. In 1999, I married an American for my sins, and 26 odd years later, I'm still paying for that one. And we've got three fabulous kids that are all in college. So we're now empty nesters. And I have actually, like your last guest, started life as an attorney in the UK. Came to the US and absolutely hated it. It was sort of I lived through that transformation of lawyers' salaries going up. Like I think my salary went up 4 times in my first year as a lawyer, which you would think is fabulous, right? I think that would be great. But what happened was that you just became myopically focused on the billable hour. And it just, for me, wasn't a fun way to live and operate, particularly having come from the UK, where we were sort of seen as a advisor to the client. It was sort of a change that I didn't enjoy. So I left and went to consulting and basically got into healthcare in the early 2000s, and have spent the rest of my career in healthcare. So the best part of 25 years now in healthcare. In the early 2000s, I went to Express Scripts, which is the time obviously was an independent but still public company. Started in the strategy team. The most iconic thing we did there was we put a 10-year plan together to buy Medco. And at the time, people thought that was a little crazy because Medco was probably 40 times the size of Express Scripts at the time. And literally 10 years later, Express Scripts bought Medco. And it was a fabulous early lesson for me as a young executive around setting a North Star and understanding where you're going. I'm sure many executives can relate to this. I'm sure you can relate to it as well, right? In any one year, you can get knocked off course, right? The winds can push the boat in a direction that you don't want to go in, or you don't want the company to go in, or the market's not playing in the right direction, or your company has issues. There are a million things, right? Executing is really hard. I'm sure we'll talk more about that as we go forward. But if you know where you're headed, it's much easier to get back on course. If you don't know where you're headed, it's really, really difficult, I think, to get back on course. And so having a North Star, knowing where you're headed, knowing what your strategic direction is, it was a fabulous early lesson for that. At Express Scripts, you really didn't have that much gravitas unless you'd run something. It rolled up your sleeves and had sort of more of an operational role. So I went to join the Medicare team, went on to run the Medicare team. We grew that business from sort of sub 10 million to over 500 million in a relatively short period of time. Another sort of good lesson in healthcare, right? We were fabulous beneficiaries of the beginning of Part D. And so understanding the role of government in healthcare and government funding and what the government's sponsoring, I think is really, really important as you think about building businesses. Epic's probably the best example of a company that's been built on the back of the government spending a lot of money on a particular piece of healthcare. And so understanding the government and what the government's doing. Then had the good fortune to meet John Doar, who had recently purchased a small health plan in St. Louis called Essence Healthcare. It was a small Medicare Advantage plan at the time. It was sub 10,000 lives. And John had this vision to go build he liked the sort of clinical model that these clinicians, primary care clinicians, were utilizing in St. Louis. And he had this vision to go build a software and services company. And so I was part of the co-founding team of a company we ended up calling Lumeris, wrote the first business plan for the company, sold the first client. Literally, as you said, from all the way through to today, Lumeris is a multi-billion-dollar company, and spent the best part of 13, 14 years growing Lumeris, and then went to run a digital health company called Kaya in the MSK space, and then a patient tracking hospital software company. And then last year, I joined a company called Diagnostic Robotics as an advisor, and I've known the CEO, Kira, for 7 years. She's just an absolute superstar. We are so fortunate to have people like her working on healthcare. She's just an absolute legend in the machine learning AI space. She's featured in museums. She's been in Forbes. She's been lauded all over. She was a professor of machine learning 15 years ago, worked early in her career at Microsoft on the search engine. And then I still blows my mind when I say this. She basically took in everything humanity wrote and predicted the first cholera outbreak in Cuba, the Sudan uprisings in 2014. At the time, was working with the Gates Foundation to send clean water in time ahead of these events. And then she started her first company, sold it to eBay, became eBay's chief scientist, and so just a brilliant career. And so she started this company called Diagnostic Robotics. Basically, we've got two main solutions. One is that we have built an agentic AI solution that automates a lot of the administrative tasks that nurses, care managers have to do in healthcare. So think all the scheduling, following up to get information, intake information, anything that is basically the administrative piece of the work of a care manager. We've automated that with voice AI and really deployed it at scale, which I think a lot of people haven't done in the space. And we can talk more about that as we move forward. And then if you imagine if she can predict things like, outbreak of cholera in Cuba and Sudan uprisings, we've taken in 60 billion claims and 100 million medical summaries, and we can identify things that are going to happen to people that might not be obvious in historical claim data, which is where most people use to sort of risk adjust and identify which populations they have. So I've been fortunate to have a fabulous career, but it's hard work. As building companies is not easy, and I don't think there are any shortcuts to building companies, but the rewards of doing so are really fabulous.
Well, that's a very good point spoken from somebody who has actually been through those battles that you have to go through. It's I always use the metaphor squeezing through the knothole. Like there's always some knothole you're trying to squeeze through, and right when you get through that one, you find the next one, which leads me to a question about your psychology personally, what drives you. You've had fantastic success, got the opportunity now to probably decide whether you are looking to have a day job or just advising and quote unquote doing the fun stuff, letting somebody else squeeze through the knotholes. Talk to me a bit about what drives you at this point in your career.
Sure. So a few things, right? Number one is, we've still got so much to do in healthcare. And I feel fortunate at this point that I've made a lot of mistakes. So you learn so much more often from your mistakes than you learn from your successes. And I've seen a lot of things. And I think I, reached a point in my career where I can really help companies be impactful as opposed to sort of treading water. We have a lot of companies in healthcare that tread water. There are a lot of companies that are, 2 million to 50 million. It's obviously it's a $4 trillion healthcare space, and there's a lot of small companies. And so I feel like I really have reached a point where I understand how we can be impactful and how companies can be impactful. And I think we've still got so much to do. And so that motivates me enormously as you think about, just whether it's access to care, which has been a passion of mine throughout my career, or the proper use of technology. Technology is an enabler of healthcare. It's not a solution in of itself. A lot of people come into healthcare from other industries, and unfortunately, I think they lack sort of understanding of healthcare, which I think is often a detriment to their success. So I think number one is there's so much to do. The second is I think we're at the precipice of perhaps the most transformational technology since the internet. If you're not thinking about how agentic AI is going to disrupt and change the way you're doing business, your head is in the sand. That's like thinking the internet wasn't going to impact your business. It is going to have a major impact on so many aspects of everybody's business, not just as you think about your actual solution or product to the market, but also how you operate, right? We've changed the way we do marketing. We've changed the way that we're doing sales. We've changed, right? So you should be looking at every aspect of your business. And if I were, as I've done, right, if I were running a company, I would be asking every head of every department to produce a memo, right, telling how agentic AI is going to impact their business and what they're going to do about it and how they're going to incorporate it. And if you're not, you're really going to be left behind. And so so that's exciting. And so the exciting part about it is that I think it's a transformational moment to really drive improvement in both access to care, cost of care, quality of care. And so that's motivating.
Yeah, there's no doubt that we're at this once in multiple lifetimes situation where the opportunity to transform industries is it's 100x whatever has happened in the past in terms of these changes that result in breakthroughs, starting from the Industrial Revolution, all the way through to, as you pointed out, the internet. And you remember the early days where there were folks who would say nobody's going to go primarily shop on the internet. And remember the cover story about Bezos. I don't remember which magazine it was, but it was after that, the .com sort of crash, and there was all this question about, is this even a thing that matters? Like, could Amazon actually compete with Sears or whatever? And Bezos's face was the entire cover of the magazine, and it said Amazon.bomb. And the entire article, the whole narrative was how they had no sustainable advantage. Like, this whole internet thing, you still have to distribute the product to the end customer. But what they did, obviously, was completely reimagine how you could bring a service level to the customer that had never before been accomplished. And I think there are so many parallels to that are happening now, but it's exponentially bigger. And it's making it so much faster and more efficient to deliver those capabilities. But to your earlier point, you just really can't all of a sudden decide, or very rarely does it work, where you all of a sudden decide you want to be in healthcare after not really having been in it. I mean, certainly one notable exception is Tempus, where Lefkowski went from Groupon to, Tempus, and they're absolutely building a fantastic story there. But typically you end up like a fish out of water. So Indianapolis, where we're headquartered with our portfolio of health cloud capital companies, we are known here for digital marketing as a core area of industry. And Exact Target was a company that became like sort of legendary story out of Indianapolis that eventually became the Salesforce Marketing Cloud. And I can remember in some of our healthcare companies, we had some people who had been absolutely stars in that digital marketing world come over into the healthcare space. And it was palpable how freaked out they were within like 10 minutes. I mean, for one, the conferences are nothing like you go to the marketing conference and it's like a bunch of good looking people, like having a big party. And you go to the healthcare conference and it's a much more serious kind of thing where you're dealing with, life or death. And the regulatory nature of the regulated nature of the business takes longer. But the thing you said, the two things I took away from your career focus now, one is you've got this unfinished business. Like you understand so much and you've seen what needs to be done. And now you see that the capability is there to start doing it. And you rewind the tape to 25 years ago when you started, the concept of delivering an experience in healthcare that was tailored to the customer, or really being preventative, or really driving to this future state where people get better faster. And it just wasn't a thing. Like, you'd go talk to the CEO of the health system, they'd say, yeah, how am I going to increase my fee for service revenue? Well, when people are sicker, you do that. But now we've got some of these emerging models. So the other thing that I heard you say was, I understand, you, Nigel, understands the economic incentives that are there, which aren't obvious. It's a, when you roll into healthcare and you're new to it, you think with logic and, hey, this is how it should work. And then you get hit in the face. It's like the Mike Tyson quote, everybody has a plan until they get punched in the face. You get into healthcare and that happens, and you're just, what do I do from here? But it sounds like with Diagnostic Robotics, you've got this very special opportunity to do something that really powers up healthcare. And you talked a little bit about that, but people use this term now, agentic AI. It's interesting. I'll give a talk and I'll say, raise your hand if you know what GPT stands for. And not a single person raises their hand. So we're in this world where we're using these technologies and talking about them, but people don't really understand them. So could you break it down to what is it specifically? Like, how does the diagnostic robotic solution work and get plugged in a way that is efficient for the user, for the nurses or the whatever the clinicians are? And then how do you see that playing out over time? Like you said, the 10-year North Star that you had was 40x bigger or whatever, and you guys did it. Like, where are we now? And then what is that 10-year North Star that you guys have?
Yeah, for sure. So it's interesting, right? So, when people think about AI in healthcare, their brain automatically goes to, I don't want a AI primary care physician, or I don't want an AI, oncologist, right? I've got cancer, obviously that's a terrible situation to be in. And and that to me is really valid. That I think the idea and concept that we will have like AI clinicians is still a number of years away, and I think that's there's a few reasons for that. Number one is people acceptance. There's still going to take a while for people to get comfortable with the acceptance. I mean, I remember, my grandmother's no longer alive, but I remember with going to my grandmother first saw an automated checkout, she was horrified. Like, I chat to Betty on the way out every time I get my groceries. The idea that I would go to a machine and check out, she was horrified by that concept. And
It
most of us
also seemed
today,
like everybody would just walk right out and not even pay for their stuff.
right? Yeah, but today we want the automated to become more and more efficient. The ones where you can just put everything on the counter and it can scan everything you have. We love those, right? And so it takes people time to accept certain things. And also, there's enormous amount of research that is out there that shows that the human connection created between a clinician and a patient has an enormous impact on your ability to be well and stay well and get better. But what that um, doesn't mean, though, is that there's no room for AI in healthcare. And so where we've sort of myopically focused on is sort of what we would call the administrative tasks. Well, the things that unfortunately take up like 80% of a clinician's time. And people don't realize this, right? 80% of their time is often spent doing administrative tasks and only 20% of them time doing clinical tasks. And so we're flipping that paradigm. We're enabling the clinician to spend 80% of the time doing clinical care and 20% administrative. So when you think about administrative care, one of the best examples I gave is, fortunately, I reached the age where I needed my first colonoscopy. And 4 different nurses called me for intake information. Just basic information, asking about my health, this, that, the other. All of that we at Diagnostic Robotics could have automated for them, right? It wasn't nothing that, you didn't need to go through clinical practice and training to fill out a questionnaire and ask people, can, have you had a colonoscopy before? Have you, right? All the questions that they asked me. And so we've automated all of those sort of administrative tasks. So the impact of that is really, really transformational, right? When you think about, first of all, we've got a staffing crisis in healthcare, right? We don't have enough nurses. There's a lot of burnout, and you rarely do you hear someone say, "I'm burnt out because I've had to see too many. I spent too much time with my patients today." Typically, right? And unfortunately, there are many, many, many technologies that are causing this to be the problem, but it's like crazy, like the number of clicks that a clinician hits on Epic in the course of a day, right? I've
Yeah.
got the stat.
Well,
We're going to
to
quote.
this point, the advent of Epic, and you referenced this earlier, the High Tech Act was the absolute massive lottery win for Epic that required you to put in place an EHR. But one of the behaviors that you see post Epic is rather than your doctor sitting and having a conversation with you, your doctor's like this, and you barely interact, and you hate it, and I guarantee they hate it. And so that's to your point, right? That administratively, their job has become to try to capture everything into some kind of a record that nobody may ever even look at again.
Yeah, Epic to me is one of the most anti-competitive forces in healthcare. It's been one of the biggest barriers to transformation in healthcare. I know that's probably not a popular opinion. If you think about not
I
just the
don't think it's an opinion. I think it's a
right,
fact.
if you think about the billions that the government spent to automate and to put records in an automated fashion, and then you think about literally the billions of dollars that every healthcare company in the world has to spend to integrate into it. I got a situation here with my wife this past week. She's trying to get into 4 different versions of my chart because she's got doctors in 4 different systems. And so, and obviously the one doesn't talk to the other and doesn't know that she had, one's asking her to go for an annual wellness check, even though she's had it and so it's costing the system. And so unfortunately, it's very, very hard though to build a company that tries to do anything in Epic space, right? Because they shut it down and they basically do, what large tech companies do. They say this is coming on their roadmap, or they put out a weak version, but they basically shut out a lot of competition. Where we're more focused in is both in sort of the health plan care management world, and then the outpatient provider care management world, where if you think about all those tasks around intake information, scheduling, checking that you've got your insurance, annual wellness visits. Mayo is an investor in ours and a great client, and we've done actually with their oncology department like a 45-minute sort of intake form, the conversation, which is so there's enormous amounts of sort of administrative tasks that go on every single day in healthcare, and that's where we focused. And the beauty of it, right, back to sort of your original question, is that it's like, we can have people up and running in use cases in a couple of weeks. And I'm sort of, I've been in healthcare a long time, and often we've had 6-month implementation periods, 9 months, 12 months implementation, all these different integrations that need to happen, and it takes a long time. What's amazing about this is that literally, if you signed a contract with us today, in 2 to 3 weeks, we could have that use case up and running. And so the ability to iterate and do it and fast and learn and improve is really exciting, because you don't have to spend ages trying to wait for that to happen.
So it's also, I think, going to dramatically change the expectations of these healthcare organizations on what they should expect out of technology. Because you're right, whether not naming any specific vendor, whatever you're talking about, typically a technology deployment in healthcare takes a long time. Usually, and the other death knell isn't just the big monolithic EHR folks, but it's also just the IT department, where they say, we've got a queue of things we need to do for the next 3 years already, so we can't get to this. It sounds like the way you deploy the solution, it doesn't require a big IT project. It's more of a use case that the business and administrative folks can say, oh yeah, that's great. Now you've got this agent that can do all of these tasks. and then surface and add in a human in the event that they're needed in that process. Is that a fair way to think about it?
Yeah, I mean, imagine take your book of businesses, right? Let's say take your businesses, and you said, hey, like I want to reach out to the to 100 people to identify if they to remind them that to have their or to schedule them for an annual wellness visit, or to check that they've taken their medication. Here are 100 high risk people, and I want to confirm they've taken their medication. Or here are 100 people that haven't filled their script for pick a high risk medication, and I want to reach out to them. So in effect, all you would do would give us the list of people and the contact information, and we would agree the script, and off we go. Like
That's
it's
awesome.
like
Yeah.
it's no. Yes, we can do a lot more integration. We've integrated into all the major EMRs. We've integrated into all the major care management systems. Yes, we can make it much more seamless that you can press a button from your workflow and you can start the outreach. So yes, we can make it much more integrated, but you don't need to do that to test out and see how it's gonna. And so what that means is that not only is it more efficient to reach out to these people of doing it by AI as a fraction of the cost of people. Secondly, it means that as you think about access to care, we have like a problem today, right? In that we know we have a staffing issue, but we also know that most call centers or outreach centers, if they go till 5, that's long. A lot of them close up at 3, right? But if they go to, but most of us work during the day. Right. And so then again, so if you think about access, we can reach out after 5 o'clock for the same cost. Right? Somebody says, I really have trouble sleeping. I'd love a call back at 1 a.m. Right. We can schedule a call back at 1 a.m. Right. It doesn't. So the ability to think about access to care is also really phenomenal. The third aspect to it is that we can reach more people. And so as you think about driving quality of care, the fact that you can now reach out to people that you just couldn't get to before because you just didn't have enough manpower to get to all 10,000 people on the list. So I think the impact we're seeing from a cost of care perspective, from a quality of care perspective, from a sort of adherence, compliance is just really, really exciting. And so I just think it's going to be transformational. And basically where we're focused on, right, is all these administrative stuff, and then doing the warm transfer to a clinician for what we would consider the more clinical things is proving out to be a really fabulous patient experience as well.
That's fascinating. Well, we focus at my company HC1 a lot on care gaps and identifying signals that previously were just never even noticed inside the lab information and other related data sets. Because you think about it, you really only look at the data when you're a clinician, when there's some acute issue, really, unless you run a standard battery of tests and there's something that's way out of range, you're just sort of like, yeah, I mean, everything's fine. But in reality, what you start finding over time is if you actually look longitudinally from birth until old age at the trends and all of this diagnostic information, there's relations in there that can do things like predict who's highly predisposed to develop cognitive decline, for example, way in advance. So you could manage that more as a chronic disease. But part of doing that and closing care gaps is you have to engage all those people. So if we go and identify, 1,000 people where there are care gaps, one of the challenges then is for the healthcare system and their care managers to go engage and enroll those people. It sounds like maybe there's a partnership in the works we had to talk
We
about.
could be your execution layer.
That's
We can
very
be your
cool. I'd love to circle back.
right.
So you brought up a very famous name that I don't want to miss out on hearing some of that story. And you brought up John Doar, who is a legend for anybody who's not in the tech venture world. This is one of the literally like the pinnacle of success in venture and tech and growing truly scaled assets that, hey, everybody's got ideas. You know what they say about what ideas are like, everybody's got one, but not many of the people in the world can actually mobilize to take an idea to make it into a thing at all. And even fewer can go make it into something that truly makes a big impact. And Lumeris, you folks did that. Tell me about John Doar. Like, what is his magic wand he's got?
Yeah. So I probably learned more at the feet of John Doar than he probably realizes that he taught. He's quite a humble guy, but I played a lot of sport growing up, and often particularly as a young player, I remember I was actually myself and a friend, we were 16 and we were going on a tour with a bunch of 18 and 19-year-olds. We were the youngest too, and we were, a good few years younger than everybody else. We went on this international tour, and you learn so much about I think there are a lot of analogies between sport and business. You learn so much about how people conduct themselves, how they think, how they act, more than often what they say. And I think that's true for John as well. The way he acts and what he does delivers, enormous number of lessons. So three in particular come to mind for me that always, live with me and I've taken with me sort of in everything I've done. The first is we closed our first deal at Lumeris. We sold Florida Blue, and everybody who's started a company knows that closing your first deal is incredibly difficult, right? You don't have can you give me some references? I don't have any references. Have you done this before? No. Have you there's nothing that
Yeah,
you're really
it's really
relying on
tough.
someone to take a chance on you, and you've got no credibility, nothing to fall back on, and so I was pretty proud. We'd closed our first deal, and I'll never forget. I've still got this email up on the wall in my office, which was an email I got from John Doar, which said, "Congratulations, now go execute." And those four words have lived with me forever, which is, there are two major parts, and we can go after I talk about John, we can go into these if you want. In building businesses, right there, the two parts that are really, really hard, I think, are go to market, particularly in healthcare. It's a really, really hard thing to do. And then execution. And that email from John was like, great, you've closed the deal, but basically you've done nothing yet, right? Until you go execute. And so execution was always one. The second one was the preparation he did, which was unbelievable. The amount of preparation that he would do and require of us to get him ready for 5-minute appearance on a news channel, or a talk he was giving in public, or just for a meeting that we were going to together. His level of preparation was beyond anything that I had seen anywhere else from any other executive.
That's a good sports metaphor there as
Fabulous
well.
sport. I mean, I tell my sales team this all the time. You'll appreciate this. It applies to any sport, right? Like the number of sales execs that oh, we've done this before. We're just going to go in and do our pitch. And and I say to them, could you imagine if you show up on Saturday and you were told, hey, the team didn't really train or prep for this week. They didn't think about tactics for this game because, hey, man, we play every week. We know, like, we're just going to come in and just do our pitch. And so the level of preparation is that goes into what he did was what you would call professional, right? What you'd expect, but professional to a sort of different level than I'd ever seen before. So that was the second. And then the third lesson for me was, it sort of blew my mind how big he thinks. Like think big. Like how do you think bigger than I want to get my company to 10 million in revenue, or get my like he thinks like on a like how do you transform the world. And so that ties into a question that you asked before, right, which is, how do we think about the potential for diagnostic robotics? I think that today we're myopically focused on sort of care management, and how do we automate those pieces of it. I think that's really, really important in healthcare, to be focused, to be really good. It takes listening to thousands and thousands of care management calls to we're obviously got a phenomenal database, right? There aren't many people out there that have in the sort of agentic AI machine learning space that have 60 billion claims and 100 million medical summaries. And so having that to train it on, and right, and is really, really important. And obviously it has to work, because if it doesn't work, it's healthcare at the end of the day. I'm not ordering a bed. I might get irritated, but I'm going to call back. If it's my healthcare, I'm not gonna go to that healthcare provider again. I'm gonna go somewhere else, right? And so healthcare, we have to get it right. And so I think it's really, really important, particularly for young companies like us, to stay focused. Many young companies sort of run after the shiny ball, right? And there's the shiny object disease, and you see another shiny object, and
Yeah.
the classic one is, someone calls from India or China or the UK, and let's get on a plane and go to, like, when we've got plenty to do here before we go. But there's so many shiny object diseases, so I think it's really important to become really good at what you do before you're trying to become everything to everybody. But beyond that, I think our vision is everything that's process related in healthcare, right? We can go on to automate that, right? So not just sort of in the sort of little space we are, right? There's so much that is that's out there to be automated. We're so many years behind other industries in terms of just basic adoption of technology, never mind of sort of agentic AI. So I think there's enormous process things to be done. I think when you look at a lot of the move to value-based care, a lot of that is sort of care management and specialized care management. I think there's enormous amount of things that we can do there. We're working already with some value-based care companies that are sort of disease specific. I think there's a lot more that could be done in that space as well. And so, our vision is obviously much greater than where we are today. I think that healthcare moves slower than we want it to move, but this technology is so much more. And I think, and again, people have an image of IVRs, right? And like press 1, press 2, press 3, and those are so frustrating, right? But this is where we've got to with this technology, is that it can look and sound like you and me, but then you get on the phone and you happen to be more comfortable speaking Spanish, and it can switch to Spanish. And not only that, we're taking in, like, if you imagine, like, we're listening to thousands and thousands of calls, right? And there are an elite group of care managers that are phenomenal. And so every time we pick up the best practice of an elite care manager, we're building that into every call. And so again, I use this analogy in business all the time. I'm sure you get on a plane like I do all the time, and I can tell inside of 90 seconds of getting on a plane if the flight attendants are good flight attendants, mediocre, or bad. Right, literally within 90 seconds, I can normally tell it. And I've actually told this to an executive at one of the airlines. Why don't you just video your best flight attendant or your best flight attendants and make everyone just watch that video? It would be a 5-minute video. Watch how they interact with the customer, watch how they greet people, watch how they deal with difficult situations. It would be so easy for them to do, just and then have them all sit and watch it once a month. Watch the flight attendant of the month for 5 minutes as part of your required continuing education to be a flight attendant. And I'd imagine they would raise the bar of their flight attendants. So imagine that's what we're doing with our AI. Every time we hear a best practice from a care manager, we're embedding that and so you're ultimately creating this phenomenal outreach engine that will only get better and better.
Yeah, the follow up and follow through part of healthcare is such a huge aspect of how it's delivered and even how effective it is. You brought up the point that humans are complex systems. They're not machines like an airplane is, where you can just boil it all down to some set of instructions. And when there's this thing going on with this vibration, where fix these things, and then everything's back and we're flying again. And part of that is there's this whole psychology thing and this mental health thing and this idea of adherence. We're seeing in our company Decision RX, where just by virtue of a pharmacist having a conversation with a high risk person who's on lots of drugs, that person ends up adhering better to whatever the drugs are that they're on. And it's even best when you make sure they're on the right drugs. If it were just a machine it was dispensing the drugs to them, I would argue that you wouldn't have that kind of adherence. And there's an emotional kind of mystical part of being human that I think humans will always be involved with how care gets delivered. I really believe that. And I think you guys have the right idea without a doubt. And certainly would bet on you and your partner, who's the founder, who sounds like an absolutely fascinating
Yes,
individual who has
rockstar.
done so much good for the world. And when it all comes out, back to this question about what drives you, and I can definitely relate to what you're saying, which is I feel like every day is this opportunity to make something happen that impacts people's lives. And certainly there's an economic aspect to it in terms of creating value that way, because if there's no margin, there's no mission. But to impact people's lives the way that you can at scale in healthcare, think about at the end of your own life when you're looking back and saying, what did I do? And was it worth it? And am I really happy with how I spent my time? I think you're doing the kind of things where you're going to be able to, with a very clear conscience, say you were absolutely doing that.
Thank you. I appreciate that. I hope so. Right. And I tell people this all the time, right? It's not difficult to motivate yourself on a Monday morning in healthcare, right? Like there's the mission of what we do is not hard to wrap your head around. And obviously I've spent 26 years in the healthcare space, and so I don't know any other industry obviously anywhere near as well as I know healthcare, but it's important work. And the frustrating thing is that we feel like there's so much still to be done, and the impact we've had is so small. That's a whole nother conversation as to whatever you want to say, $4 trillion healthcare system. And if you think about you know, we gave Epic a little bit of a hard time before, right? But Epic is a $5.5 billion company, right? It's tiny when you think about the total spend in healthcare, right? And so if you compare that to sort of the tech companies, it's not even a division, right, of big
Right.
tech. So to me, they're two really important lessons from that, right? The number one and I mentioned this before, is that technology is not a service or a product in healthcare. It's an enabler. I got to listen to a fabulous interview with the CEO of Clear, the
Hmm.
airport
Yeah.
and security company. And she spoke beautifully about how the actual technology, the terminals, the right, that's not her product. Her product is your and my experience from the moment we arrive in the airport, just using the airport one as an example, or the moment we arrive at a stadium to the moment we're through. That's her product. The whether it's a terminal, whether it's something else, like that's just an enabler. And so the lesson I always feel that in healthcare, right, is that technology has to be healthcare as a service. We need to receive healthcare from somebody. We need a drug. We need something, and so we need a checkup. So technology. Really, like, I think it's really important for those people who are building business healthcare to think about the fact that you're an enabler of service. You're not a be all and end all innovative yourself, right? You talked about your predictive analytics. That's great, but someone's got to go do something. If no one does anything with it, then it's just sitting out there and on somebody's cloud. Then great. But so I think that's number one. The second thing that reminds me when I think about where the cost is in healthcare, right, is that there's big payers and the big health systems control 80% of the cost, and that's really who has to really drive and adopt change. And I think that they talk a good game of change, but and they dabble in different pieces of it, but they're both business models under enormous pressure right now. Both the payer business. My hope is that this creates an opportunity for them to be more innovative rather than less innovative, because of the pressures they're under. When their business models are not under pressure, you're not under any great incentive to change and to drive adoption. And so I'm hopeful we have a moment in the sort of evolution of US healthcare where you've got the people that really control big chunks of the spend under pressure, that creates an opportunity where they adopt and drive more innovation. So I think we're at an exciting moment because of that.
Yeah, I think it's happening. I really do. I agree with you, and incentive absolutely drives behavior. That is universally true. And to your point, there has to be some kind of intervention that's carried out in an efficient way in all different areas of healthcare, which plays right into your what I think about as like an agentic operating system for process that can help make everything run better and smoother and help make it more tailored to the individual who needs to have whatever that intervention is, which isn't necessarily clinical in terms of what you're doing. It's more executing what has to happen to support that clinical team, which is massive. And the closing comment I'll make, and I would love to keep the conversation going because this is fascinating and I live for this kind of stuff. But I read a book years ago called Titan. I love biographies. And it's one of the many, probably, I think, the best John D. Rockefeller biography. And he was known for his focus. And they said his big saying was, we have to always know what to focus on to the detriment of everything else. And I think that's what you're describing in your entrepreneurial playbook with any new company, especially in healthcare. Pick that thing, that one thing that you know will start to get the flywheel moving. And then eventually it gives you all kinds of other opportunity. But if you let every shiny object spread you out and you're chasing 50 different ways, in your case, to automate these administrative issues, you will end up getting nowhere because you're doing too many things. It's do less better and you go further faster.
Yeah,
So I would love to keep the conversation going. I'll definitely be following you guys closely and would like to have a follow up on potential partnership opportunities, as you said, to connect into some of the execution capabilities you're building and have developed at your new company. And I am absolutely just blown away by how much you've done. But I think more than that, I'm blown away by how much energy and optimism and how committed you are to doing whatever that next big thing is. If you're good with it, maybe at some point down the road we get you back on and talk about where you've gotten over the coming months and year or so. And would love to have a chance to meet up sometime and continue comparing notes here. Thanks so much for being on the podcast.
appreciate it. I'm happy to come back, and thanks for everything you're doing to help move healthcare in the right direction.
Yeah, and at some point when we have more time, we can talk about Liverpool football. The best team out there in the soccer world, right?
For sure. That's absolutely right.
Awesome. Well, thank you again, Nigel, and hey, thanks everybody in the Boombostic Health community for being here for episode 40 of Boombostic Health. We'll look forward to seeing you next week.